Malaria. It is not just another disease. It is a serious epidemic disease that can cause grave ill health and death. It is also a disease that has enormous repercussions on social and economic development. As a result of an intensive program launched by the Anti-Malaria Campaign with financial support from the Ministry of Health, this terrible disease has been eliminated from Sri Lanka. In 2016, Sri Lanka was certified by the World Health Organization as a malaria-free country, creating a major landmark in the history of public health of the country. However, the greatest challenge now is to prevent the return of malaria to Sri Lanka. Although the malaria parasite was eliminated from Sri Lanka, the vector mosquito that transmits malaria is highly prevalent in the country. Therefore, there is a high risk of reintroducing malaria to Sri Lanka through people who arrive in the country with a malaria infection which they have acquired while in foreign countries which are endemic for malaria. These could be either Sri Lankans who travel abroad for leisure or employment, or foreigners visiting this country. Since 2013, all malaria patients who have been detected in Sri Lanka had been infected with malaria while visiting or working abroad. Please continue to support us to keep Sri Lanka free of malaria. If you do plan to travel to or work in any African, Latin American or Asian country in which malaria is prevalent, please do the following. Obtain the necessary advice and medicines to prevent yourself from getting malaria from the Anti-Malaria Campaign Head Office or its regional offices. Start taking these medicines 1 week before your departure and continue for 4 weeks after return. After returning to Sri Lanka, as the risk of developing malaria persists for about a year, if you develop fever anytime during this period, make your doctor aware of your travels and get your blood tested for malaria. We need your support to keep Sri Lanka free of malaria in the future. We ask that you too fulfill your responsibility and provide your active contribution to this important goal to keep Sri Lanka malaria-free. This is a message from Anti-Malaria Campaign, Ministry of Health.